It's here because ophthalmology referred it concerning, he's got one of his eyes is exophthalmos, so it's poking out. There he did a CT and they were concerned that the lymph nodes might be enlarged. So they are concerned he might have lymphoma. So Dr. Berg may sample some lymph nodes, and potentially, if he has something consistent with lymphoma, you could consider chemotherapy.
So hold his head down.
This eye is, this left eye is the one that's more exophthalmos.
Are they both doing it?
Maybe a little bit on the right, but you can see his third eyelid is pretty elevated on the left. And if you retropulse them, they feel a little bit different. It's always kind of spooky to retropulse little things' eyes, but they do retropulse both of them. The left one is definitely like it's different.
This little patient has immune-mediated polyarthropathy, meaning his immune system was acting up and started attacking his joints. On his x-rays, you can see that the bone is literally kind of eaten away, and that has caused quite a bit of instability in this dog's ankles. So we are going to make him some custom orthotics to help him walk more normally. Do that. I'm going to try and go for a standing angle of 140 at his tarsus, and then you can see his toes are quite contracted. So I think if I can get him into 140, I can get him still into digigrade stance. All right, so we just made these castings of this little dog's hock. He does have quite a bit of abnormal structure because of his disease, so his ankle is much thicker than you can see in this molding. We didn't go all the way up to his knee, but we're pretty close, and then his toes are included as well. So I'm going to send this up to Canine Orthotics up in Canada that's going to make a custom orthotic for this pet. And hopefully he'll be able to walk much more normally. So Buddy here is back for the fitting of his custom orthotics. As we talked about before, because of how his immune system attacked his joints, these joints are very unstable in multiple planes. So we're not only trying to help him be able to stand, we're also trying to stabilize these joints so that he can bear weight on them more appropriately. In the course of getting his disease under control, his toes have started to contract. So you can see his toes are quite flexed here. So he is unable right now to stand with his toes at a normal angle. You can see he's starting to pull away because it's uncomfortable. So we worked with Canine Orthotics, hold on friend, to make these braces. The ankle does not bend, it's rigid, but it's rigid in multiple planes so it can support his joints. And we made measurements of exactly how flexed and extended his ankle and his toes can be to make this brace. So now, when I put him in the brace, it fits nice and snugly, and it accounts for his toes being flexed and still will allow him to get up and move around. Buddy is going to go home with these braces. We start very slowly, so he'll wear them for short periods of time, like 10-15 minutes, a couple times a day for the first day. Each day we add an hour of time total, so instead of just 4 15-minute wearing periods, he'll do 6 or 8 the second day for a total of 2 hours of wear, a total of 3 hours of wear, so each day we add an hour. I'll see him back in about 2 weeks to make sure that he is using the braces appropriately, that he's not developing any rubbing anywhere. If so, we will remove bits of the lining to get rid of the rubbing area. And if he looks good at 2 weeks, we will release him to use his shoes every day, all day.